Hi, I'm Dr. Jack Ringer, and I'm here at Keating Dental Arts presenting one of our educational videos in a series that Keating Dental Arts is going to have for you online. Today we're going to cover analog impressions. When you're taking your impression and you're using your syringe, the best way to do it is take that syringe and start it at the bottom of the sulcus gently and slowly bring it up. Okay? Then you're not forcing air down. Don't push the material down because there can be pockets of air that the impression material covers up. So start at the bottom, inject slowly and bring up, okay? And in all likely you won't trap any air. And then when you take your tray to put it in, gently put it in and kind of like jiggle a little bit. If there's any air, you'll force it out. And then have the patient either close lightly. Make sure when they close that their opposing arch isn't torquing the tray. So you may want to put some cotton rolls and have them just lightly close to relax their jaw so the tray remains stable.